legislature.
Thanks for watching TMA's Legislative News Hotline for Friday, February 20th. I'm Brent Anier. This week was all about the budget. Two House Appropriations Subcommittees and the Senate Finance Committee heard testimony from their constituents talking up their budget wish lists. TMA physicians were on hand to ask lawmakers for improved funding for Health and Human Services budget items, including physicians' Medicaid and CHIP payments, mental health and women's health services, and more. Dr. Martin Garza, an Edinburgh pediatrician, asked Senate Finance Committee members to improve Medicaid payment rates for doctors to Medicare levels. He explained that doing so in the past helped draw more doctors into the program, but that without that boost, physicians struggle to keep their doors open.
What we need is the parity there between Medicaid and Medicare. And that was shown to us over the last 2 years, where in 2013 and 2014, the rates were equal through federal funds. Now what happened was that the physician workforce went up by 5% instead of going down as it had been over the previous years.
TMA Board of Trustees Vice Chair Dr. Doug Curran then asked senators to restore coinsurance payments the state used to pay doctors for caring for Medicare and Medicaid dual-eligible patients. He reminded senators the state cut their copays and deductibles in 2011. The deductibles were later restored, but not the copays, meaning doctors take a 20% pay cut every time they care for one of these patients, who are typically the most frail, sickest patients they see. He said the funding helps these patients receive more and better care, and doing so makes fiscal sense.
I asked specifically for restoration of copays and deductibles so that we're made whole as a result of this. These are our hardest patients, and we should be paid well for taking good care of them, keeping them out of the hospital, and hopefully saving a ton of money for the state because they're not in the hospital, they're not in the emergency room. Our goal is to take care of all Texans. That's what Texas medicine is about, is the health of all Texans. And we want to care for them, but we have to be able to do that within our business framework. That's how we survive.
In total, there were lots of doctors in the House in Thursday's Senate Finance Committee meeting, 7 TMA physician leaders, in fact, including Drs. Curran, Garza, Les Sechrist, Janet Riolini, Louis Foxhall, Joel Dunnington, and Philip Huang. Earlier in the week, Dr. Huang also addressed the House Appropriations Subcommittee examining the Health and Human Services budget. He urged support for 3 major public health efforts: tobacco prevention and control activities, infectious disease and disaster preparedness, and chronic disease prevention.
Public health and prevention efforts pay for themselves. We estimated, for instance, just to address chronic diseases, it costs about $751 for every person in Travis County to pay for the health care costs associated with the chronic diseases, such as cancer and heart disease and chronic lung disease and diabetes. And these investments are very, they do pay for themselves and are very important to make.
Austin family physician Dr. David Wright began the week's events by asking Appropriations Subcommittee on Monday to support more graduate medical education funding. He runs a family medicine clerkship program for medical students, so he sees firsthand why half of Texas medical graduates are forced to leave the state for residency. And Governor Greg Abbott gave his take on the budget during his first State of the State address to House and Senate members. He asked for additional funding for Texas's women's health care programs and mental health services for veterans. The governor also made it clear he would not support expanding the Texas Medicaid program. That's it for this week. Thank you for watching. I'm Brent Anier with TMA. Please join us again next time for TMA's Legislative News Hotline.